Hi, this is Dr. Diaz again with Momentum Chiropractic and Rehab. I'm here today with James. He was here a couple of days ago. He had a car accident. And initially when he came in, he reported that he had a clinically diagnosed concussion. He's had whiplash, he had upper back pain, low back pain with very hypertonic muscles. He's had restricted motion and in general explain a lot of pain. So when we do have a car accident patient that comes into our clinic, we'd like to start with some sort of muscle therapy to relax the muscles. So what we use is we use electronic stimulation, we use hot packs. We use some soft tissue therapy prior to the adjustment. Like I said, we've seen him one time and he's had some great results. Can you explain a little bit of what you experienced after your first visit?
After the first visit, I noticed a increased mobility in both of my neck and my back area. Biggest measurement was when I was driving. I was unable to look into the blind spot of my car without actually moving my shoulders. After the first visit, I was able to turn my neck completely to view my blind spot without moving.
Perfect. So we're going to go ahead and continue care. As we're getting him better, we want to see increased mobility in the neck and decreased hypertonicity in the muscle. So we're going to start with some electronic stimulation. All right, so we have James prepared for electronic stimulation. We're going to use electronic stimulation. We're going to use hot packs to prepare his muscles. We have a few tight and tender trigger points. The most common ones are going to be right in here, and you can't hear him wincing already, but I can feel that. He's going to have some issues here in the neck, so we're going to hit a couple of trigger points here, We're going to continue down the back right here, and we're going to go right here just to have some general stimulation of his paraspinals here. So you're going to watch an electronic stimulation machine right here. This machine, we're going to set it at about 15 minutes. What this machine is going to do is going to send electric current to contract his muscles. This muscle contraction is going to increase blood flow locally. Blood has oxygen and it's good for healing. So we're going to create a micro massage for healing with electronic stimulation. So we're going to set these pads right on him here. We're going to set one right in here. We're going to set one right at the same trigger point on the opposite side here. And we're going to set a pad here. Again, similarly, we're going to hit a couple of trigger points right down the rest of the spine here. So we're going to set one in here. I don't have to continue pressing and palpating, as I've already had a general idea of where I'm placing these pads. Okay, so we're going to go ahead and start here. We're going to start right up here. Let's focus on the upper set, please. You let me know, James, when it's good enough for you, okay?
Okay.
And you'll see, as we increase the stimulation, it's going to start contracting right in this region. You tell me when it's good enough for you.
That's good.
Okay, very good. So we've reached a level of where it's enough that he needs right in this region. We're going to go ahead and go and start the lower one. You tell me when.
All right.
Good, very good. We're going to set that up. Next thing we're going to do is we're going to apply some hot packs to his back. These hot packs are going to help him relax, help him get prepared for a chiropractic adjustment. Hi, Dr. Diaz again. We have James here. Just a quick reminder, he was in a motor vehicle accident. He got T-boned. He had some neck pain with a diagnosed concussion. What he's reported is the stiffness in his upper back. We've already gone ahead and done some soft tissue stimulation and some heat, so we're going to go ahead and adjust now. He's also reporting some restriction into his right shoulder, so I'm going to use a Myofascial Release technique to loosen that up a little bit here. So let me have you go ahead and extend your arm out to the side, and when I tell you, go ahead and move the arm forward. Go ahead and go. Very good. Come back to neutral. Go ahead and go forward. You can go and grimace. I know it hurts a little bit. Very good. Come back out. And one more. Go. And come back out. I want you to move that shoulder around. Tell me how that feels. Better, worse, or the same?
Much better than before.
Good. Very good. Now let me have you scoot forward just a tad here under the chair. As we identified earlier, we've already palpated him several times, and we have more restriction. We have some restriction in the upper cervical here, but if we can definitely see the restriction right in this side on the upper cervical region. We are going to adjust bilaterally in the upper cervicals here, and we're going to go ahead and go posterior, anterior here. Relax for me. Very good. Excellent movement. Could you relax here for me? Excellent. Very good. Okay. Let's have you lay face down right here on the table. Very good. How'd that feel?
Fun.
Good. Very good. All right. All right. We've already palpated here in the mid-thoracics. We already know that around T5 he has some restriction here. Let me have you take a deep breath in for me and completely exhale. Very good. Okay. Take a deep breath in for me and completely exhale. Very good. I want you to relax here. We're going to go ahead and get some movement in the cervical thoracic junction. So about C7, T1 region. Take a deep breath and completely exhale. Okay. Relax right in here. Take a deep breath and completely exhale. Very good. Very good. Let's have you lay on your side facing this way for me. Very good. We also have some pain down in the lumbar spine from his accident. We've also noted some restriction in the lumbar spine, and we're going to go ahead and adjust accordingly. Take a deep breath for me. Completely exhale. Very good. Turn facing the opposite leg for me. Get some movement in there. Yeah. Top leg bent, bottom leg straight. Very good. Right over here. Right in there. Take a deep breath for me. And all the way out. Very good. Important to know that you're in a motor vehicle accident. Come visit your local chiropractor, Dr. Diaz here in Manassas, Virginia.